Lyme disease is a bacterial infection people pick up from tick bites. The concern we have currently with testing in the United States is there are some labs in the United States that are so-called Lyme, especially the laboratories, that have a very high incidence of false positive tests. Because some patients with non-specific symptoms are looking for a diagnosis, they sometimes look for Lyme as being a diagnosis and end up getting blood tests done in those labs in the United States and end up with a false positive. That's the current concern. They are told either on the internet or through advertisements there are some labs in the United States that are better than others. And recent studies have shown that these labs that are supposedly better are actually not better, just have a higher incidence of false positive results. For people who are concerned that they might have Lyme disease, their physician can look at what their risks are for Lyme disease, what their symptoms are, and see whether it's actually even worthwhile doing a Lyme test. There are about 500 cases a year diagnosed in Canada. Most of them are either in southern Ontario, southern Quebec, or the Maritimes, and some of those cases are actually diagnosed in people who've traveled. So people who travel to areas in the United States where Lyme is endemic, or people who travel to Europe where Lyme is endemic. Well, the most important thing about Lyme disease is not to get it. And it's transmitted by ticks, and ticks also transmit other infectious diseases, which are not pleasant to have. So the important thing is to try and prevent yourself when you go into areas where there are ticks from getting bitten. And those simple things like using DEET on your skin, you can use permethrin in your clothing, you can be fashionable and tuck your pants in, and those sort of things to prevent tick bites. The other thing is when you come out of an area where there are ticks, just to check yourself for ticks and remove them as soon as possible.